Welcome to Healthy Living Guide. Are you losing strength even though you stay active? You're eating right, staying on your feet, and maybe even going for regular walks, yet your muscles still feel weaker than they used to. If this sounds familiar, you may be experiencing something that affects millions of older adults, sarcopenia, or age-related muscle loss. Sarcopenia is a silent condition that begins as early as your 40s and accelerates with age. By the time you reach 70, you could lose up to 30% of your total muscle mass, even if you're relatively healthy and active. This muscle decline isn't just about appearance or fitness. It's about maintaining independence, preventing falls, and preserving quality of life as you age. What's even more alarming is that this muscle loss often goes unnoticed until it's already affecting your mobility and energy levels. Simple activities like getting up from a chair, climbing stairs, or lifting groceries can suddenly become difficult. And while many chalk it up to just getting older, there's a major piece of the puzzle most seniors are missing: critical vitamins and nutrients that directly support muscle health. The truth is, your body's ability to absorb and utilize key nutrients declines with age, leaving your muscles starved for what they need to stay strong. Nutritional deficiencies, even mild ones, can accelerate muscle wasting and make your efforts to stay active far less effective. In this video, we reveal the 6 essential vitamins and supplements every senior should consider to combat muscle loss and reclaim strength. Whether you're already experiencing signs of muscle weakness or you're simply looking to age well and stay strong, addressing nutrient gaps could be the most effective first step. When paired with light resistance training and healthy lifestyle, these nutrients can dramatically slow down or even reverse muscle loss in seniors. Don't wait for the symptoms to get worse. Take charge of your muscle health today with science-backed strategies that are safe, natural, and effective for older adults. Watch now to discover how these essential vitamins can protect your muscles, boost your energy, and help you stay strong and independent at any age. This video is only for education purpose. Before starting any medication, consult your doctor. What is sarcopenia and why does it matter? Sarcopenia is the progressive loss of muscle mass, strength, and function that naturally occurs as we age. While it's often overlooked or dismissed as just getting older, sarcopenia is a serious health condition that can impact balance, mobility, and overall quality of life. Starting around the age of 40, muscle mass begins to decline gradually, and by the time a person reaches 70, they may have lost up to 30% or more of their muscle tissue. But sarcopenia isn't just about shrinking muscles. It's a condition that affects your independence, energy, and safety. It raises the risk of falls, fractures, hospitalizations, and long-term disability. In fact, it's one of the leading contributors to frailty in older adults, making everyday tasks like climbing stairs, lifting objects, or even walking more difficult over time. The primary causes of sarcopenia are multifactorial, but 3 main lifestyle-related factors play a significant role. 1. Inactivity. A sedentary lifestyle is a major driver of muscle loss. Without regular resistance or strength-based movement, your body signals that muscle maintenance is no longer a priority. This leads to faster degradation of muscle fibers, especially the type 2 fast-twitch fibers responsible for strength and power. 2. Poor nutrition. Diets that lack adequate protein, essential vitamins, and minerals are another key contributor. Your muscles need the right fuel to grow and repair, and as you age, your body's ability to absorb nutrients declines. That means even if you're eating normally, you may not be getting enough muscle-supporting nutrition. 3. Chronic inflammation and hormonal changes. As we age, natural levels of hormones like testosterone and growth hormone drop, and inflammation tends to rise. This combination leads to an environment where muscle is broken down more quickly than it is built. Even more concerning is how vitamin and mineral deficiencies can accelerate sarcopenia. Nutrients like vitamin D, vitamin B12, magnesium, and coenzyme Q10 play direct roles in maintaining muscle metabolism, nerve signaling, energy production, and recovery. When your body lacks these essential nutrients, muscle loss can progress even faster, no matter how active you try to be. That's why understanding sarcopenia is more than a medical concern. It's a call to action for older adults to take control of their muscle health through proper lifestyle, movement, and nutrition. The good news? Sarcopenia is not inevitable. With the right interventions, including daily movement, resistance training, and targeted supplementation, it can be prevented, slowed, and even reversed. Top 6 essential nutrients to stop muscle loss. Number 6 is creatine, a powerful ally for aging muscles. When most people hear the word creatine, they often think of bodybuilders or athletes. But research shows that creatine for elderly adults is not only safe, it's one of the most effective supplements for maintaining muscle strength, mobility, and energy as we age. As we get older, we naturally lose muscle mass and strength, a condition known as sarcopenia. This loss can affect everything from walking and balance to independence and quality of life. That's where creatine steps in. It's a naturally occurring compound found in your muscles that helps produce ADP, adenosine triphosphate, the main energy source your muscles use during movement and resistance. Studies have consistently shown that creatine supplementation in seniors can improve muscle strength and size, especially when combined with light resistance training. Enhance mobility and functional performance, such as getting up from a chair or climbing stairs. Support brain health and cognitive function, which is another area of concern for aging adults. Help reduce the risk of falls and fractures by improving lower body strength and coordination. One of the best parts? Creatine is safe for older adults when taken at the recommended dose. Unlike some muscle-building supplements, creatine has been thoroughly studied in older populations. Clinical trials involving seniors aged 60-80 plus have found no harmful side effects when used correctly. The standard dosage for most seniors is 3 to 5 grams per day, typically taken with water or a small meal. No need to load creatine, taking large amounts at first. A consistent daily dose is effective over time. Some people worry about kidney health when taking creatine, but studies show that in healthy individuals, creatine does not impair kidney function. Still, if you have pre-existing kidney issues, it's wise to speak to your doctor before beginning supplementation. Another major benefit? Creatine works even for those who are not heavily exercising. While combining it with resistance exercise provides the most benefit, even sedentary seniors have shown gains in strength and muscle mass from creatine alone. For best results, take creatine daily and consistently, ideally after a meal that contains some carbohydrates and protein to improve absorption. In conclusion, creatine for elderly adults is a simple, science-backed supplement that can support muscle health, independence, and vitality in later life. Whether you're already experiencing signs of muscle weakness or just want to stay strong as you age, creatine could be a powerful addition to your healthy aging routine. Pair creatine with other essential nutrients like vitamin D and magnesium for even greater muscle support. Keep reading to learn more about how these nutrients work together to fight age-related muscle loss. Number 5 is vitamin D, the sunshine vitamin that protects muscles and bones. Vitamin D is one of the most important yet commonly overlooked nutrients for seniors. Often called the sunshine vitamin, it plays a crucial role in maintaining both muscle function and bone health, two areas that decline rapidly with age if left unchecked. For older adults, vitamin D deficiency is alarmingly common, especially in those who spend limited time outdoors or live in colder climates. As you age, your skin becomes less efficient at producing vitamin D from sunlight, and your kidneys become less effective at converting it to its active form. This creates a perfect storm for low vitamin D levels, which can lead to muscle weakness, balance issues, and an increased risk of falls. Studies show that low vitamin D is strongly linked to sarcopenia, age-related muscle loss, frailty, and reduced physical performance. Seniors with vitamin D deficiency are significantly more likely to experience difficulty walking, standing, or recovering from minor injuries, and they're also at greater risk for osteoporosis and fractures. Here's why vitamin D is vital for seniors. Vitamin D helps regulate calcium and phosphorus levels in your body, both essential for proper muscle contraction and movement. Deficiency can impair coordination and reduce muscle strength, particularly in the legs. It promotes calcium absorption in the gut, which is necessary for maintaining strong bones and preventing conditions like osteoporosis. Weak bones combined with weak muscles increase the risk of falls and fractures, a serious concern in older adults. As a bonus, vitamin D also helps regulate the immune system, which becomes less efficient with age. Best sources of vitamin D. Getting enough vitamin D becomes more difficult with age, but it's possible through a combination of sources. Sunlight. Aim for 10 to 30 minutes of midday sun exposure on the face, arms, or legs, several times a week, depending on skin tone, climate, and time of year. Foods. Fatty fish like salmon and mackerel, egg yolks, liver, and fortified foods such as milk, orange juice, and cereals are good sources. Supplements. For most seniors, a daily supplement of 800 to 2,000 IU of vitamin D3, cholecalciferol, is recommended, especially during winter months or if sunlight exposure is limited. Signs of vitamin D deficiency in seniors are muscle pain or weakness, fatigue and low energy, poor balance or frequent falls, and bone or joint pain. Always talk to your doctor before starting a vitamin D supplement. A simple blood test can determine your current vitamin D levels and help guide your dosage. Number 4 is vitamin B12, the energy and nerve support nutrient you can't afford to Mississippi. When it comes to staying strong, energized, and mentally sharp as you age, vitamin B12 plays a critical role. This essential B vitamin supports energy production, nerve function, and red blood cell formation, all of which are necessary for healthy muscles and overall vitality. Unfortunately, vitamin B12 deficiency is very common in older adults, and it often goes undiagnosed. One major reason: as we age, our bodies become less efficient at absorbing B12 from food due to a decrease in stomach acid and a condition known as atrophic gastritis. Additionally, certain medications commonly prescribed to seniors, like proton pump inhibitors and metformin, can further interfere with B12 absorption. Without enough B12, your nervous system and muscles can't function properly, which can lead to a wide range of concerning symptoms. Why vitamin B12 is so important for seniors? B12 is crucial for converting the food you eat into usable energy at the cellular level. A deficiency can leave you feeling tired, sluggish, and drained, even after a full night's sleep. B12 maintains the protective myelin sheath that surrounds your nerves. When this sheath deteriorates, it leads to nerve damage, which can manifest as tingling, numbness, and muscle weakness. Because your nerves control your muscles, a lack of B12 can directly cause muscle weakness, poor coordination, and even difficulty walking, especially in the legs. Common symptoms of vitamin B12 deficiency in seniors are chronic fatigue or low energy, muscle weakness, especially in the legs, tingling or numbness in hands and feet, trouble walking or maintaining balance, memory problems or brain fog, and pale skin or shortness of breath. If you've been experiencing these symptoms, particularly muscle weakness without explanation, it could be a sign of vitamin B12 deficiency. In fact, searches for vitamin B12 muscle weakness are on the rise as more seniors become aware of the connection between this vital nutrient and age-related muscle issues. Best sources of vitamin B12 are animal-based foods: beef, liver, eggs, dairy, and fish like salmon and tuna. Fortified foods: many cereals and plant-based milks are now fortified with B12. And supplements: seniors often require B12 tablets, sublingual drops, or injections if deficiency is severe. The recommended daily intake for seniors is at least 2.4 milligrams, but some individuals may require more based on lab results and absorption ability. If you suspect a deficiency, ask your healthcare provider for a simple blood test. Treating B12 deficiency early can prevent permanent nerve damage and restore energy, strength, and function. Number 3 is magnesium, the unsung hero of muscle recovery and strength. When it comes to staying strong, flexible, and pain-free as you age, magnesium is one mineral you don't want to overlook. This essential nutrient plays a vital role in muscle relaxation, cramp prevention, and protein synthesis, all of which are crucial for combating age-related muscle decline. As we grow older, our magnesium levels tend to drop due to factors like reduced dietary intake, chronic health conditions, and certain medications, such as diuretics or antacids. A deficiency in magnesium can lead to muscle cramps, spasms, fatigue, and even weakness, making it much harder to stay active and independent. Why magnesium matters for seniors? Magnesium acts as a natural muscle relaxant. It helps regulate muscle contractions and prevents the tightness or spasms that often come with low levels. Without enough magnesium, muscles can become overstimulated, leading to cramps, especially at night or during physical activity. One of the most common signs of magnesium deficiency in older adults is frequent leg cramps. These painful episodes often occur during sleep or after exercise. Restoring magnesium levels can significantly reduce the frequency and severity of cramps. Magnesium is also essential for building new proteins in the body, including the proteins that make up your muscle fibers. Without it, your muscles can't grow, repair, or maintain their strength properly. Magnesium helps with proper nerve function, which is critical for muscle control and coordination, especially in aging adults who may already be dealing with reduced mobility or balance issues. Signs of magnesium deficiency in older adults are muscle cramps or spasms, especially in the legs, weakness or low endurance, twitching or tremors, fatigue and irritability, trouble sleeping or staying asleep, Natural sources of magnesium are. One of the best things about magnesium is that it's found in many whole, nutrient-dense foods, including leafy greens like spinach, kale, and Swiss chard, nuts and seeds, especially almonds, pumpkin seeds, and cashews, whole grains such as brown rice and oats, beans and legumes, dark chocolate in moderation. Despite being present in food, many seniors still don't get enough magnesium through diet alone. That's why supplementation is often recommended, especially for those with muscle-related symptoms or chronic health conditions. The typical dosage for magnesium supplements ranges from 200 to 400 milligrams per day, depending on individual needs. Magnesium glycinate and citrate are often preferred forms for better absorption and fewer digestive side effects. Avoid taking magnesium at the same time as certain medications or calcium supplements, as it may interfere with absorption. Magnesium is a key nutrient for preventing muscle cramps, supporting recovery, and maintaining strength as you age. Whether through food or supplements, making sure you're getting enough can go a long way in preserving your muscle health and quality of life. Number 2 is vitamin C, a collagen builder and inflammation fighter for aging muscles. When we think of vitamin C, we often think of immunity, but this powerhouse nutrient does far more, especially for seniors looking to maintain muscle strength, tendon integrity, and overall recovery. Vitamin C is essential for collagen production, which forms the structural framework of muscles, tendons, ligaments, and connective tissue. As you age, your natural collagen production slows down, leading to weaker tissue support, stiffer joints, and longer recovery times. Without enough vitamin C, the body struggles to repair and maintain the musculoskeletal system, increasing the risk of injury and muscle degeneration. How vitamin C supports muscle health. Collagen is a key component of tendons and muscles, helping them stay elastic and resilient. Vitamin C acts as a cofactor in collagen formation, meaning your body can't build or maintain collagen without it. For aging adults, this means that a vitamin C-rich diet or supplement can help maintain muscle tendon health and mobility. Vitamin C is a powerful antioxidant, protecting muscle cells from oxidative stress caused by aging, inflammation, and physical activity. This is especially important for seniors, as chronic low-grade inflammation, inflammaging, contributes to muscle wasting and fatigue. Because of its antioxidant and tissue-repairing properties, vitamin C plays a role in muscle recovery. It can help reduce soreness and support faster healing after exercise, minor strains, or injuries. Another important benefit of vitamin C is that it enhances the absorption of non-heme iron, the type found in plant-based foods. Iron is essential for oxygen transport in the blood, and low iron levels can contribute to muscle fatigue, weakness, and anemia, common problems in older adults. Taking vitamin C with iron-rich meals or supplements can help prevent these issues. Signs you might be low in vitamin C are slow wound healing, frequent bruising, muscle or joint pain, dry or damaged skin, fatigue or weakened immunity. Best sources of vitamin C. The great news is that vitamin C is easy to get from a variety of fresh foods, such as citrus fruits, oranges, lemons, grapefruits, bell peppers, especially red and yellow, broccoli and Brussels sprouts, strawberries and kiwis, tomatoes and leafy greens. For seniors who have difficulty eating enough fruits and vegetables, a daily supplement of 500 to 1,000 milligrams of vitamin C can help fill the gap. Since it's water-soluble, your body flushes out what it doesn't need. But high doses may occasionally cause digestive upset, so it's best to start low and work up as needed. Vitamin C is far more than an immune booster. It's a vital nutrient for muscle integrity, inflammation control, and recovery. Combined with a balanced diet and proper supplementation, it can help older adults stay strong, resilient, and injury-free. Number 1 is coenzyme Q10, cellular fuel for aging muscles. As we age, one of the most common complaints is a loss of energy and muscle stamina, even with regular activity and good nutrition. If that sounds familiar, coenzyme Q10, CoQ10, might be the missing piece in your muscle health puzzle. CoQ10 is a vitamin-like compound naturally produced by the body. It's found in nearly every cell and is concentrated in the mitochondria, the powerhouses of your cells that generate ATP, your body's main energy currency. Without enough CoQ10, your cells, especially muscle cells, struggle to produce energy efficiently, leading to fatigue, muscle weakness, and poor performance. Why CoQ10 is crucial for seniors. As we age, CoQ10 levels decline naturally, which can impair mitochondrial function. This means your muscles may not receive the energy they need to function well, leading to reduced strength, slower recovery, and even increased fatigue from simple daily tasks. Clinical studies show that CoQ10 supplementation may improve exercise capacity, muscle power, and overall endurance, especially in older adults. Even if you're not a competitive athlete, these benefits can make a real difference in everyday life, from walking longer distances to climbing stairs more comfortably. Seniors frequently report low energy, and in some cases, this is due to suboptimal mitochondrial function. By replenishing CoQ10, you support your body's natural energy production system at the cellular level, which can help you feel more alert and active. If you're taking cholesterol-lowering statin medications like Lipitor or Crestor, pay special attention. These drugs are known to deplete CoQ10 levels in the body. That's why many doctors recommend supplementing with CoQ10 to help prevent statin-induced muscle pain, cramps, and fatigue. Signs you might need more CoQ10. Chronic fatigue or low stamina. Muscle pain or weakness. Shortness of breath with activity. Brain fog or poor memory. If you're taking statins or beta blockers. How to get CoQ10. CoQ10 is found in small amounts in foods such as fatty fish, salmon, mackerel, sardines, organ meats, liver, heart, whole grains, and nuts. However, food sources usually don't provide therapeutic levels, which is why supplementation is often necessary, especially for seniors. The recommended dosage for older adults ranges from 100 to 200 milligrams per day. Look for ubiquinol, the active form of CoQ10, which is better absorbed, particularly in older individuals. Take CoQ10 with a meal that contains healthy fat, as it's fat-soluble and absorbs better with food. Coenzyme Q10 helps fuel your muscles from within by enhancing mitochondrial energy production. Whether you're experiencing fatigue, muscle weakness, or taking statins, CoQ10 may be a vital tool for restoring strength and staying active well into your senior years. Warning signs of muscle loss. Early signs of sarcopenia, age-related muscle loss, include slow walking, weak grip strength, and increased fatigue. These symptoms are often subtle at first, but they can indicate a decline in muscle mass and function, which affects daily activities and overall quality of life. Ignoring these signs can lead to further weakness, reduced mobility, and a higher risk of falls and fractures. Seniors experiencing these symptoms should not wait. It's important to get tested for vitamin deficiencies and muscle health issues. Early intervention can prevent further damage and help maintain strength and independence. How to incorporate these nutrients? To support muscle health, it's essential to get a balance of dietary sources and supplements for the key nutrients like creatine, vitamin D, vitamin B12, magnesium, vitamin C, and CoQ10. Diet sources. Incorporating nutrient-rich foods such as fatty fish, leafy greens, nuts, seeds, and fortified cereals is an effective way to naturally boost your intake. Focus on whole foods that provide a variety of vitamins and minerals for overall health. Supplements. In cases of deficiency or difficulty meeting nutrient needs through diet alone, supplements can help. For seniors, it's often recommended to take vitamin D, magnesium, and B12 in supplement form. Always consult your doctor before starting any supplementation, especially if you're on medication or have underlying health conditions. Incorporating resistance training into your routine alongside a healthy diet can further stimulate muscle growth and strength, helping you combat sarcopenia and maintain independence as you age. Sample daily routine for seniors. Creating a daily supplement routine for seniors is essential for maintaining muscle health, strength, and overall vitality. Here's a simple, well-rounded routine that includes key nutrients at the optimal times of day. Morning. Start your day with vitamin D. Since it helps with muscle function and bone health, taking it in the morning with breakfast or after a light stretch is ideal. Vitamin D is fat-soluble, so pairing it with a meal that contains healthy fats like avocado or nuts can boost absorption. A brief session of light stretching can help improve circulation and flexibility, setting a positive tone for the day. Afternoon. After a light resistance workout, it's time for creatine. Creatine supports muscle strength and recovery, making it an ideal post-workout supplement. Taking 3 to 5 grams of creatine after exercise will help your muscles regenerate and build strength. A simple body weight workout or a few minutes of lightweight training can maximize the effects of creatine. Combining exercise with nutrition is the most effective way to combat muscle loss. Evening. Before dinner, Take magnesium and CoQ10. Magnesium helps with muscle relaxation and prevents cramps, while CoQ10 boosts mitochondrial energy and combats fatigue. These supplements can support your evening recovery and prepare you for a restful night's sleep. A well-balanced dinner rich in protein and healthy fats will complement your supplements, helping you feel energized and well-rested. By following this daily supplement routine for seniors, you ensure that you're nourishing your muscles, promoting recovery, and maintaining energy levels throughout the day. Preventing muscle loss as you age requires a combination of proper nutrition and a healthy lifestyle. Essential nutrients like creatine, vitamin D, B12, magnesium, vitamin C, and CoQ10 can help support muscle strength, reduce fatigue, and improve recovery. Pair these with regular resistance training to maximize results. Don't wait until it's too late. Start fueling your muscles today. By taking proactive steps now, you can maintain strength, mobility, and independence for years to come. Consult with your doctor, incorporate these nutrients into your routine, and keep your muscles strong for a healthier, active life.